Thank you, Dr. Judd, and all of the sponsors for this afternoon's activity. I'm Paul Irwin, Dean of the School of Public Health here at UAB, and I want to welcome you to our Lunch and Learn with Dr. Allison Russo, Ohio State Representative and an alum of our UAB School of Public Health. Dr. Russo is currently serving her third term in the Ohio House of Representatives and also serves as the minority leader for the Ohio House Democratic Caucus, which is why going forward you will hear me refer to her as Leader Russo, which is the title that she is known by in her home place. So with a focus on evidence-based solutions, Leader Russo has introduced a number of important legislation pieces to address healthcare access, the protection of public health and safety, and the financial security of family caregivers and aging adults for constituents living in Ohio. She has received several state and national awards for her work on mental health, early childhood, aging, and disability issues, and is a passionate advocate for women and families. Before joining the legislature, Leader Russo spent more than 2 decades advising government leaders and policymakers on issues related to the healthcare financing and care delivery needs of seniors, vulnerable populations, veterans, and military families. She holds a DRPH in health policy from the George Washington University and a master's in public health and epidemiology from UAB. And while today's talk will primarily focus on Leader Russo's work as a state representative, it should be noted that she also currently serves as a research director for Kennel, is that the right pronunciation? Kennel and Associates, where she specializes in efforts related to payment and delivery reform, the evaluation of healthcare quality, improvement initiatives, and the analysis of policies affecting healthcare costs and utilization. Leader Russo, thank you and welcome.
Thank you.
Thank you for joining us today.
Thank you, glad to be here. And thank you all for braving. Hopefully you beat the rain. I hear it outside.
So I'm going to start with a couple of questions, Leader Russo, that could take the rest of the time.
Perfect.
What got you interested in health and what got you interested in politics?
Yeah, 2 very separate things. My journey to public health was not very well planned, and the same could be said about my journey into politics as well. My undergrad degree was in microbiology, so very science-focused. I originally thought that I would go to medical school and do that right out of undergrad. But I had the opportunity, I went to undergraduate at Mississippi University for Women, which is about 2 hours from here in Columbus, Mississippi. And as a student, we were able to participate in what's called Southern Women in Public Service, and this was an annual conference that used to be held in various cities across the Southeast. And it was at one of those conferences that I actually was able to connect with one of the health directors in the state of Georgia. And I remember having a conversation with her, and she was talking about her training in public health, and I thought, that's something I've never thought of before. I should explore that. And very quickly, I was researching, what are schools of public health in the Southeast? What are the admissions requirements? Because I was particularly drawn, at the time I thought I would pursue infectious disease epidemiology because of my microbiology background. And that's kind of how I got to that path. So I sort of stumbled upon it and then got to the School of Public Health and loved it, knew I was in the right space. Politics, also stumbled into that. If you had asked me even 10 years ago, do you imagine yourself being in the space of politics, I would say you were out of your mind. No way. I certainly throughout my career have had a very policy-focused jobs and work, but the work was very much on the back end. I say, good or bad policy, my job and my role was to make it work. And under multiple political ideologies, I worked with folks from every end of the political spectrum that you could possibly imagine, very nonpartisan in the work that I was doing. But I will say, I think like many people, we were just having this conversation at the table, the 2016 elections, I think took many of us who I would say have always been engaged politically, but on the sidelines, to being in the arena. And I started to become more engaged. If you will recall also at that point in 2017, there was debate both in Washington about repealing the Affordable Care Act. And in the state of Ohio, we were deeply engaged in debate. We were one of the first states to expand Medicaid, even under a Republican administration, former Governor John Kasich. And there was a lot of conversation in the legislature during the budget process about freezing that Medicaid expansion enrollment, which would have had devastating impacts. 1 million people in the state of Ohio would have lost health insurance. And so I became more engaged in the advocacy space, because it turns out healthcare is a very complicated topic. And using my knowledge and experience to help individuals advocate better for this issue to both their federal representatives, but also at the state level. And the next thing I knew, people were saying, you should consider running for office. And I was like, no way, that's crazy. I had a 6-month-old, my youngest was 6 months at the time, young children. But then I also started to think, well, why not me? I could do this, because I was meeting with my legislators. And I thought, well, I certainly could do their job. I'm qualified, and a seat opened up, and I thought, well, if it's not me, who else will do it? So I ran and won, and here I am.
Bravo.
Yeah.
I really appreciate that courage. Amazing place to be in 2016. So we'll probably spend most of our time talking about your experiences as a representative, as a minority leader. But let's take one more question about your professional experiences before you got into politics. Talk a little bit about that and about how your MPH impacted those professional experiences.
Yeah, so when I finished my MPH program, in my personal life, I met a guy who was a young Air Force officer, and we decided we were going to get married, so I got married very shortly after I finished this program in 2000. And he was assigned as an Air Force officer overseas in Germany. At Ramstein Air Base. And so I was a little bit, I just finished this graduate program and did really well, loved this work. But it's, as a military spouse, extremely difficult to work in your profession. In fact, military spouses have some of the lowest, or some of the highest unemployment rates of any group of individuals. And it's actually something I've worked on in the legislature to make that better in the state of Ohio. But at the same time, both OEF and OIF were beginning. So that was, we moved there in 2001, so it was shortly after September 11th. And as those operations ramped up overseas, I happened to be in the location where Launchstool Hospital was, and we were getting many injuries coming back through Launchstool Hospital, and as a result, the family members of servicemen and women who were serving in that region were being sent out to what we called host nation care providers. And so there was a real big need in both the military health system there locally, which provides that direct care, but also the TRICARE program, which is the health insurance program, to figure out what they were going to do. And I happened to be at the right place at the right time, and I got hired by what was called a TRICARE regional office at the time to manage this issue and assess what is the quality of care in those host nation facilities and how could we facilitate payment better and make sure that we're still getting value for the care that is delivered and we're still getting the same outcomes. And so that was the bulk of my work for 2 years, and just incredible work. I worked with just an incredible team, but it also gave me the opportunity to work with host nation care, Germany, the UK, working in Italy, working in many North African countries, working in many Middle Eastern countries to understand their healthcare systems. And it turns out I was pretty good at that because I had fabulous training here at UAB. And then when my husband was reassigned stateside, we were back in the DC area, and I started working at the national headquarters for TRICARE, and continued that work for both the military health system, but then I transitioned and began working with another agency, the Agency for Healthcare Research and Quality. Did lots of similar projects there for a few years. Came back to the company I work for now, Kellogg Associates. We're a consulting firm, and I now have a huge portfolio of projects, both with the VA system, with the military health system still, have done lots of work and projects in the evaluation space with the Centers for Medicare and Medicaid Services, specifically CMMI, which is the Center for Medicare and Medicaid Innovation, which came out of the Affordable Care Act. And so, have gained just a ton of experience, primarily working on this issue of how do we incentivize value in our payment models.
Yeah. I would think that those experiences overseas, when you were working in the German healthcare system or the national healthcare system in the UK or other places, really informed some of your thinking and decision making about expanding Medicaid in Ohio.
It did, absolutely. Certainly gave me very interesting perspective on what are the positives that come out of those systems, but also some of the shortfalls of those systems as well. Because to be clear, there are many systems throughout the world. Some arguably provide better outcomes than our system here in the United States, but they all have some of their drawbacks, and kind of understanding how to comprehensively look at those issues and understand them when you're thinking about health policy in the space that I have been in, especially at the state level in the Medicaid program, can be very informative. And in Ohio, we are uniquely positioned in that we were one of the first states to expand Medicaid. There is no one on either side of the aisle at this point talking about rolling that back. Yeah. We certainly have a lot of conversations about how we can control cost in that space, but we've actually been able to move even further in the last couple of General Assemblies. I'm proud to say I've had a part in that, and expanding it even more in certain spaces, particularly in the perinatal care space.
Can we get you to stop by Montgomery on your?
Sure, love to. You gotta expand Medicaid first. So lots of good incentives now to do that, as many of you know.
Well, I know there are folks in the School of Public Health who have certainly provided the right information. I'm thinking in particular of Dr. David Becker's white paper on expanding Medicaid and the very positive economic climate that can produce, let alone the health.
That's right.
So
yeah, at this point, we're far enough into Medicaid expansion that there is no good reason not to do it.
Thank you.
Except the politics.
Thank you. So you talked a little bit about what spurred you to run for state office. Talk a little bit about what worries you may have had then, or what concerns you might have had, both personally and professionally. I mean, this was 2016, a very divisive time politically. What concerns,
Sure.
what,
Yeah. Well, politics are not for the faint of heart. It is rough business. And so certainly, for me, and I ran for the first time in 2018 in that cycle, and there were many individuals like me who ran for the first time in 2018. Our state elections, state legislative races are in even years. I can't remember if Alabama is also in an even year. I know Mississippi is on an odd year, and the state of Virginia. So 2018 was really the first cycle post 2016 that we would have been able to run. And I think certainly the hesitations are you open yourself up to a lot of criticism, you lose all privacy. At the time, my kids were very young. My husband had his own career, and it was kind of like, do we really want to do this? But I also felt very compelled. There's really no other way to say it, and feeling like it was the time for me to step up and to put myself in the arena. And there were many other, particularly women, who felt the same way that cycle. And I ran with an incredible group of candidates that cycle. But it comes at great sacrifice. I mean, not only the campaigning piece is very time intensive. It is a grind. I didn't know this at the time, but I was in the most competitive state house race in the state of Ohio the year that I ran. Again, if I'd known that before, I probably would not have volunteered to do it. But I was one of 6 seats that flipped that year. So it was the raising money piece, the knocking on doors. My team, we knocked on 45,000 doors that cycle, which is insane. But I felt like it was the thing to do and the right thing to do. And I haven't regretted it since then. And certainly none of that changes when you're in public office. It probably becomes even more intense, and especially in the current political environment, which really is, unfortunately, this zero-sum game, which is what turns so many people off from politics as well. But I also felt that having come to this without real political experience, and having more real-world experience and being very focused on what can I do in this position that makes a difference and makes some progress on these very complicated issues, and the work environment that I had been in, which was very non-political, and particularly when you work in a military environment, you get people from all walks of life and all different thoughts. Made me understand, how can you find common ground with people, or at least understand framing and perspective on issues to try to come up with solutions that are palatable to the most number of people. And I, remain, even as the minority leader, which in and of itself is a bit more of a political position, I remain very focused on that piece of it, because I do believe at the end of the day we can make a difference. We do have more in common than things that we disagree on, and these issues are so critically important to the people that we serve in our communities.
Right. So I'm curious about your role as a legislator, particularly when it comes to supporting or facilitating legislation that is healthcare or public health focused or oriented. How do you navigate that political context that's got to be very complex?
It is, and some of it depends on what the issue is. So when I first came into the legislature, I knew I wanted to be a voice in the healthcare space because of my background, and wanted to leverage that expertise to be a voice for that. So I positioned myself so that I was serving on the House Health Committee. I was serving on what was called our Joint Medicaid Oversight Committee, because I'm still probably one of 3 to 5 legislators who actually understands Medicaid in and first of all knows that it's not Medicare. I position myself to be on what we call a House Finance Committee, which sets the state budget, because all of the funding for Department of Health, Department of Medicaid, Department of Aging, all of those agencies fall in that committee. And I knew that, when you control the money and decisions being made about the money, you're able to be very effective. So number one, it was sort of knowing where to position myself. But particularly in the healthcare space, and I do want to talk about how the pandemic sort of shifted some of this.
Good.
But in the healthcare space in particular, it becomes easy. We're dealing at the state level. We're dealing with workforce issues, healthcare workforce. We're dealing with Medicaid. We're dealing with scope of practice issues. Those are kind of the three biggies that we will work on in the legislature, and some of and this goes back to scope of practice, but licensure issues. And I actually found that the Health Committee was one of the places where we could get a lot of bipartisan work done, because you could have some of those conversations without kind of the political, I guess the politics coming into it, and you could be more focused. But a lot of this work is very driven by relationships. It all starts with relationships, and you have to be very intentional as a legislator to build those relationships with every single member, no matter what party they are in, where they come from, to figure out, what are the things that they care about and what are their values, so that you can connect. And because you never know when you're going to need them or have to work with them on something. And the other part is, as part of that, building trust as someone who they can rely on to give you a straight answer, or be committed to coming up with what is, the best answer for an issue. And so that takes a lot of time as well. And I could go on and talk about things like coalition building and how that helps with this too. And I think our universities and schools of public health are a very important part of that as well. And so you have to be, I think, to be an effective legislator, you have to be very intentional about these things, and especially in the healthcare space. And also, and I think I mentioned this to someone else, it's about how do you, because you have developed those relationships, you've developed that trust, you understand also how to frame these issues in a way that is meaningful to someone that you're working with. And so, for example, understanding that if I can frame some of these healthcare issues as an economic issue or as a workforce issue, it resonates, and there becomes a sense of urgency to deal with it. And so that's what you kind of learn in how best to navigate, particularly in this space.
Yeah. So Leader Russo, you gave me the space to ask the question about how the pandemic impacted the way in which health and particularly public health related legislation was dealt with, and the fallout on relationships. So can you speak?
Well, sadly, this is not a feel-good story. I think, listen, at the beginning of the pandemic, and I was halfway through my first term when the pandemic hit. So I was elected in 2018. We started the General Assembly in January of 2019. The pandemic hit in March of 2020.
And just to reiterate, you're going into this at that time, you did your MPH in epidemiology.
Correct.
So you
I was
knew,
like, epidemiologists, we're going to have our moment. This is our moment to shine.
You knew what incubation period meant.
That's right.
You knew what herd
And not just
immunity.
epidemiology, but infectious disease epidemiology.
So
right.
sorry to interrupt, but I wanted to reiterate that.
I wasn't excited about the pandemic, but I was like, okay, this is our moment. Like, people are going to know what an epidemiologist is. And public health is finally going to get it's due and we're going to get the funding that we, have always been underfunded. Like, people are going to understand our value. That's really naively what I thought in the very beginning of the pandemic. Very quickly in the state of Ohio, and I think in many states, we started to see a shift very quickly in pushback. And so in Ohio, again, our current governor, Mike DeWine, who was governor at the time, I think was one of the very first governors to actually shut schools down in March, and we saw many states actually follow immediately after that. And let me just also set this context of, for those of you who don't know Ohio, Ohio is a state that, while we probably have this reputation of being kind of in the middle of everything, we're not that much unlike Alabama's politics, and there are a variety of reasons for that, mostly gerrymandering, which I won't get into in this discussion, but when I said all of this because also in the state of Ohio, and interestingly enough, our neighbors up north, Michigan, there is a lot of distrust in government institutions. I think we've got the second highest number of militias in the country, second only to Michigan. And so there's a lot of government mistrust. Preceding that, I knew, having been on health committees and very embedded in this space, we also had a large anti-vaccine movement that had gained a lot of power and foothold in the legislature even before COVID. That was concerning, and I was raising some of the alarm bells about that as well. Plus, we had this, large, just lots of distrust in government institutions in the state as a whole. So all of this was, and then you put on top of this a worldwide pandemic, and I think many of us who come from a science-based background, like many of you in here, we know that science is not always definitive. I will remember, one of my very first meetings I had in the pandemic was actually with the dean of the School of Public Health at Ohio State, the Ohio State University, which I happen to represent. And he said, remember, we just met this virus a few weeks ago. So we were, in that part of scientific research where you are learning. Science is very iterative. You're learning new information, you're changing, you're learning. Those of us who work in this space, we understand that because that's just part of the process. The general public does not necessarily understand that. So on top of the distrust, what we already had is an anti-vaccine movement. And then you have this pandemic that no one, we don't know, guidelines are changing, information is changing, all part of the scientific discovery process. People are becoming even more distrustful because they feel like, well, do they even know what they're talking about? You're lying to us, all of these things. So we started to see protests at the State House as early as June of 2020. And they were quite intense. And the anti-mask, anti-open Ohio, all of these groups, and they very smartly combined many of these kind of anti-government movements that we were already seeing in the state of Ohio. It was like the perfect storm of all of these things to create this huge distrust. Then we started to see, unfortunately, some of my colleagues in the legislature understand that maybe this would be politically advantageous to them to grasp onto this as well, because there are a lot of power struggles that were happening at the time between the legislature and specifically the Speaker of the House and the governor, Governor DeWine at the time, because the governor had, as all governors, until some recent legislation, at the time, all governors have a tremendous amount of power when it comes to public health emergencies. And this was all post 9/11, post anthrax scare, things that happened in terms of the power that governors got to respond to public health emergencies. And so there was tremendous pushback and distrust of public health leaders, Our director of health, Dr. Amy Acton, she was, gained national notoriety because of how she was navigating through the pandemic. The legislature pushed very hard against her, pushed very hard against the governor, to the point that by September of that year, we were on the floor of the House removing powers from the governor. And this is an all Republican-led legislature and governor, by the way. They were fighting each other and taking away his power. And we still, even in 2024, see the remnants of that now in both the people who have now been elected into the legislature, into how public health and those departments, not only are they now underfunded, but we're now seeing budget cuts to those departments. And that anti-vaccine movement has grown even stronger, as we all know nationally. If you look at childhood vaccination rates, pushback on really a number of issues in the space. I mean, now we've got people even doubting HIV/AIDS research. It's just become even more intense, and I don't know what the answer to is, but it is certainly not where I think we thought in the very beginning we were going to go with it.
I'm going to go on to explore the long shadow of COVID regarding the limitations to public health and the unintended consequences. I believe in Ohio within the last couple of years there was a measles outbreak, and
In fact, we had one this past month.
the ability of the local health officer to act was limited because of the concerns over certain legislation that had been passed. So the concerns that the routine duties of public health will be impacted by the legislation that was passed. What do you, as a legislator, do with that?
Well, first let me say that I was, not surprisingly, one of the strongest, most vocal supporters of public health and public health powers on the floor of the legislature when that was being debated. And I specifically talked about what would happen as a consequence of this legislature. I think I even talked about measles and the response to measles, because we all know that public health was not just COVID, and that there were going to be broader environmental, other infectious diseases, implications for this. But at that point it had become so politically charged that there was no winning of the argument. Certainly with the majority of the time of the legislature, because even though quietly behind the scenes some would say, I can't believe we're here, I agree with you, politically it just became difficult for them to take a vote that would maintain those public health emergency powers. So yes, we're seeing the consequences of very bad legislation and an over response. And listen, let me just say this. I think that there was some merit to having a conversation about public health emergency powers and how we could make that better, because certainly there were mistakes made in the response, absolutely. But it was an overreaction. And as a result, you pointed out, we've had we've had multiple measles outbreaks in the state of Ohio. Again, that's the anti-vaccine piece, plus the ability of our county and local health directors to respond to it, because they've become very limited.
Well, let's shift it to something maybe more rewarding and positive that you've experienced in your role as a legislator. Are there particular healthcare policy issues that you really enjoy working on, that you find rewarding?
Well, there are many, and again, I go back to what can we find agreement on. one of the spaces that I have had an incredible success is dealing with and addressing the needs of both our aging population as well as our population with disabilities. And Ohio, not unlike many states, a big piece of this is the workforce able to care, so that those direct care providers, so your nursing assistants, home care providers. And in Ohio, I mean, really it was at a beyond, it wasn't even a crisis, it was beyond crisis, just completely unsustainable. And a lot of this was being driven by wages, the wage issue, and how much we reimburse those providers through the Medicaid program. And so being able to work with both sides of the aisle to get those wages up, that was a huge priority of ours in this last budget cycle. We wanted to get them up to $20 an hour. We got them to 18, which was significantly increased from, I think they were starting at average $13 an hour. That was incredibly rewarding because that makes a difference in people's lives. Not only, were we at a point where people's lives were at risk because they weren't getting the care that they needed in their homes, but it was also the burden on family members to be those providers at home was also taking those family members out of the workforce, which was only exacerbating our larger workforce issues. And so that was, I was very pleased that we were able to make some progress on that. The other place where, we've been able, we still have so much more work to do, but we've been able to make a surprising amount of progress and find common ground is on issues around children's health and infant mortality, infant and maternal health. We are also a state that has high infant mortality rates, high maternal mortality rates, not as high as Alabama's, but still very high. And how do we get, for example, home visiting programs in place in the state? How do we get postpartum care? We were able to expand Medicaid to include, take advantage of the CMS's incentives to expand postpartum care. That was another big win that we had in this last budget. And those are things that make a huge difference. But again, this is where those relationships, that coalition building, so that when my counterparts who maybe don't share, my knowledge in this space or my passion in this space, but we've got coalition partners that they trust coming in and advocating for this, makes a huge difference. And to see that payoff is incredibly rewarding.
So you're balancing duties as an elected leader and as a healthcare provider. Have those roles ever come into conflict?
Well, I'm not a provider, but as a healthcare, certainly in this space, professional. I mean, have they come in conflict? Yes. There's certainly been a number of issues that have come up that, I think as someone who has experience in this space or knowledge, that's not how we really should be doing this. I'll tell you one of the issues I came into the legislature very passionate about was this issue of surprise medical billing. And partially because I worked on this issue with TRICARE in particular. We worked with them to come up with some models to address this. And the two legislators who were working on this issue did not have that experience and had some very interesting ideas in this space. That I repeatedly met with them, gave gentle suggestions. It was very long and drawn out, again, working with coalitions of people to help influence that. I will say by the time it was done, I actually think the legislation that we passed, and I was very proud of this, what we got to in the end is probably one of the better state models now in the country and how to address surprise medical billing. And we're still, that's being implemented. A lot of this is also in how it's implemented and making sure it gets implemented in the way that it was supposed to. But I I guess that's a positive story. There are many times when maybe a path that we go down, I think that's not supported by the research. That's not going to work out the way that we think that it's going to work out. And I try to be vocal in a way that, again, is helpful, not harmful. And sometimes I'm successful and sometimes I'm not.
Okay. So let's take you back to UAB for a couple of minutes and talk about some of the lessons you learned either in the classroom or out of the classroom when you were here at UAB that have helped you in your career.
Well, I think first and foremost, I think the study of public health is it is a multidisciplinary field. It teaches you how to approach problems and issues really holistically when you use that public health framework. And certainly that is one of the fundamental things that you learn in the classroom at UAB when you first come into the program. I will say that those skills in how to approach a problem, thinking about that public health framework, has made me a much better legislator because you learn very quickly. First of all, as a legislator, you rarely get to go very deeply into an issue. I'm fortunate because I came to it with a lot of training and knowledge in the healthcare space. But for most issues, you're just about an inch deep on many, many different issues because I can have meetings where I start the day talking about housing, I end the day talking about semiconductors and everything in between. And that's just, the role of a legislator. But many of our biggest issues, things like housing, affordable health care, access to quality education, transportation issues. Some of our biggest issues, if you're not looking at that holistically and what the impacts of those issues can be, for example, housing, keystone to health outcomes, it is a keystone issue to educational outcomes, it is a keystone issue to economic mobility. I could do the same thing for transportation. If you're not able to look at these issues holistically, again, we don't do we can't make any progress in any of those issues on our own. And so we have to understand, what are the various touch points with people that we need to come along with us on these issues, that we can talk to, advocate for, build coalitions around to make progress. For example, in our last budget cycle, we had historic investment in public transportation and public education. But public transportation, part of the reason that worked is because, with some legislators, we were able to talk about access to addiction recovery services and how important transportation, particularly in rural areas, is in that space. Or we were able to talk to how important it is to move the workforce from where people live to where the jobs are, and everything in between. And you have to be able to sort of holistically look at an issue to be able to do that effectively.
Fantastic. Students, I hope you have heard the language of social determinants of health here and what Leader Russo is talking about, right? Transportation policy is health policy. Education policy is health policy. And a systems approach forces you to think about and talk about social determinants of health.
Right.
So we're close to the end, Leader Russo, but let me ask you one final question for you to comment on. What is one piece of advice that you would share with public health students or other students in the room interested in following in your footsteps?
Well, I would say be open to the possibilities. Again, I start back with, I did not plan to be in politics in the way that I am now. I never could have imagined that, certainly not in 2000 when I was finishing my program. But I would say, for those of you who are at the beginning of your career journey, be open to possibilities. be open to taking risk and having maybe new, slightly different experiences than what you originally imagined. And you know, there are a lot of opportunities out there at all levels of government to be engaged. You know, volunteer for a local campaign if you want to understand how that works. Again, reach out to your state legislator or local elected. But you know, also I think don't be afraid to maybe take a little bit of a different opportunity that maybe is not fully thought out, but sounds exciting. And I think you know, all kinds of places you can end up, and I certainly, again, never imagined that I would end up here, but it seems perfect for right now.
Great. Well, thank you so much, Leader Russo, for a really terrifically engaging conversation. We are so proud to call you one of our alums and appreciate you making this trip to come and spend time with us and share your experiences with us. Please join me in thanking Leader Russo. And thanks also to all of you, our participants, Kimberly, for all the logistics and your leadership here. Again, to the Lister Hill Center and to all the other sponsors. And to you, our participants, thank you for taking your time to join us for this conversation. I hope you have a good rest of your afternoon. Thank you.